Hi, I'm Dr. Behnam and I specialize in hair restoration and hair transplantation. And the focus of this video is to talk about how to achieve great results. And this is very important. I have been doing hair restoration since 2008 and I dedicatedly only do hair restoration and nothing else, even though I'm part of a bigger dermatology and hair restoration practice, but I only specialize in hair transplant, hair restoration, research, and development. So over the past many years, I have seen thousands of patients from around the world who had hair restoration, and I've seen the mistakes, I've seen the bad results, I've seen over harvesting, I've seen unnatural hairlines and patterns. So in this video, I'm going to tell you how I do things differently based on all my experiences in order you can achieve the best results. What I've learned over the past many years is that hair restoration is an art. It's procedure, surgery, and an art. And the extraction is an art, site creation is an art, and placing of the grafts is an art. And full dedication and focus is required. And one of the most important things that will ultimately affect outcome is the fact that doctor and the staff are focused only on you, not 2, 3, or 4 other patients having the procedure at the same time. So in my practice, I only perform 1 hair transplant surgery a day, not 2, not 3, only 1. I'm focused, as well as all my staff are dedicated and focused to you. There's really no other procedures going on that day, and this is the #1 most important thing I've learned over the years. Other important things include somebody who is dedicated and only does hair restoration. That means in my practice, I'm not jumping between doing Botox and then hair restoration or doing some other medical procedure, cosmetic procedure. No, I only do hair restoration and nothing else. And being dedicated and focused and really thinking about how to improve patients' results 24/7 is really important and will really benefit you in getting great outcome. Other important things include having a dedicated staff. I train my staff, they only work for me, they are not independent contractors, they do not jump from one clinic to another, they only work for me. They know what I want, they know what my expectations are. Everybody works for me, day in, day out. We do hair restoration every day and we're all focused. Now let's talk about how the entire FV hair transplant works, and I'm going to talk about how I do things differently based on my experience of seeing so many patients right from all around the world, and how I change things and I make things different. Hairline design is very important. Making it look seamless and natural is one of the most important things in hair restoration. So how do I do it? I see a lot of cases where the hairline looks very straight, is very crooked. There are a lot of 2s and 3s at the hairline itself, and these don't make it look natural. Again, it comes back to performing only 1 case a day, continuously looking at the patient throughout the day. So before the grafts are placed, small little slits that match the size of the grafts must be made, and then the grafts are placed into it. As I'm making it, I continuously look at the design. So I stand in front of the patient, make sure that my head and nose is aligned, and I look at the hairline and I make sure it's on very similar planes, it's not too symmetric, it's not straight. One of the key important things is that I make the designs myself. I make all the site incisions myself. There's no assistant, there's no physician assistant who's doing it. I'm doing it. So as I am basically creating all the sites, I continue to stop as I get very close to a hairline and I look at it, make sure it's natural. the angulation must be right, and the pattern must be right. And these are crucial in getting very natural look. So in this case, I'd like you to take a look. You see that on the left side is a patient who has a class 2 hair loss, and the right side we have repaired it. If you take a look at the angulation of the hairs, you notice that it gradually changes from going in a downward direction to gradually in an upward direction, and it blends in extremely very nicely. In nature, nothing grows on straight lines. Your hairline shouldn't either. So the way I make that happen is that I do zigzag patterns on the hairline itself. So when we place the grafts are actually placed in a zigzag fashion. So when it grows out, nothing's on straight line. So when someone looks at you, it looks very natural. I see a lot of places where they go all the way to the hairline, the single, so all the grafts with 2s and 3 hairs are done in a straight line, and then the singles are done in a triangular fashion, and those do not look natural. The way I've learned that it looks natural is an art. How do I achieve density? Density is very important. The way I achieve density, first and foremost, is the fact that I take my time creating the slits. So the slits are the little holes that the grafts are placed into. A lot of times, patients tell me that the doctor who performed the procedure only spent 10 minutes with them throughout the whole day. Well, let me tell you, just the site creation itself takes me about almost 2 hours to do. Why is that? Because in order to achieve that density, I have to create a slit and I have to put pressure on it so the oozing stops, and then make another slit very close adjacent to it so you get the right density. There are also other important factors that I've learned over the past many years. Achieving nice density like this depends on a lot of key factors and elements that are very intrinsic to your own body. This density really depends on understanding how your grafts are set up, how many numbers of 2s and 3s you get, and how thick your grafts are. These factors are key in achieving great density, and the fact that I understand these issues, I have come up with solutions for them. Just imagine if the skin is really hard, which does occur, for example, in certain ethnicities, individuals, especially ethnic skin, it's very hard to place a graft. So we have to overcome it by somehow softening up the skin. These little things that end up giving you the best results. Now you may ask, how do I know all these factors? Well, every patient has my personal cell phone number. Patients communicate with me and they send me pictures of how the grafts look like the next day and the following day, so I could see how easily the grafts settle down and what kind of results they get. So ever since 2008, I've been following patients very carefully, and since I only perform one procedure a day, I have made changes so I know what results in good outcome. And I could tell you it goes back to the fact that I'm focused on the one case a day and I take my time. When we do a 2,000 graft case and we want it to be dense, it takes me about 2 hours to make it tight, make just the designs, right? Sitting down and making sure that it frames the face nicely and appropriately. And then the placing also takes time as well, because this is an art. Please note that the size of the grafts, the length as well as the width makes a huge difference. So sometimes some hair follicles that have 3 hairs in them span about 2 or 3 millimeters in width and 4 to 6 millimeters in length. We measure every one of them and we separate the grafts based on not just graft with 1 hair, graft with 2 hairs, graft with 3 hairs, as well as the width. And the instruments are used to make the slits match your own hair follicle width and length. And there are various locations that we put the grafts with 3 hairs. So the grafts with the 3 hair does not go in a very small slit, because as you're trying to put it, you're going to damage it. It has its own dedicated place. so that in order it goes in easily, and by going in easily it achieves a very high graft survivability. Now let's talk about how the entire FUE procedure is performed and how I do things differently to achieve such a high successful hair restoration. FUE hair restoration basically means using a punch and individually extract the grafts out. On the day of the procedure, I have to shave the back of the scalp. There are certain grafts that come as 1 hairs, 2 hairs, 3 hairs, and 4 hairs. The reason that I do the shaving is because I want to extract the best quality grafts ever. I don't even allow the shaving to be done by assistants. Why? Because if you shave the back of the scalp too close, right, then you can't differentiate between a graft with 1 hair, or 2 hair, or 3 hair, or 4 hair. When we perform hair restoration, for the frontal region, you need some ones to create sense of naturalness. However, you need a lot of 2s and 3s to create a sense of thickness. So I just don't want to extract a lot of 1s. Minimal as possible. My goal is to extract as many 2s and 3s so you get maximum thickness and naturalness. And you pay per graft anyways. It is to your advantage that I get a lot of graft with 2s and 3 hairs. At the end of the day, all patients in my practice get a graft count. In my practice, not only I do all the shaving myself, I do all the extractions myself as well. This is very important. This is how you achieve good results. I'm the doctor, I'm the captain of the ship, I'm responsible for achieving those great quality grafts for you. Before I extract the grafts, I do need to numb the area. It's slightly uncomfortable, but I do give you some Xanax and Valium and laughing gas, and patients like it and they do very well. The extractions are a very important part of the entire hair transplant procedure. The way I do extractions is very unique. I do it myself. There is no physician assistant, there is no medical assistant who's doing the extractions. You need to know that extracting the hair follicle is an art itself. Sometimes the hair follicles are extremely long, sometimes the hair follicles bend, they are curvy, they're wavy, and I maneuver the skin in such a way to extract the grafts out very nicely, and then we evaluate every graft under the microscope. But more importantly, what I see a lot is the fact that extractions are done on straight lines when they're not performed by the doctor itself. It's very easy to just sit down and extract, but when extracting, the person who's doing it has to really think about how it's being done. So no 2 extractions are done in straight rows. The edges are not straight. They're done in zigzag patterns. Again, this is an art itself. I remove only 1 out of every 4 or 1 out of every 5 grafts so that when the back of the scalp heals, it heals uniformly and evenly and there are no patches. These are very important. So as I'm extracting, I take my time, I step back, I take a look, I make sure I'm removing 1 out of every 4 grafts, number 1. I'm making sure that the edges are not straight. I'm making sure that the one area is not being over harvested. So during the initial design that I give, right, and I'm looking at the back of the scalp, I know which areas, how many grafts I'm going to extract at one time, so when the hair actually is growing in that region, it grows evenly. Despite all these, you need to know that these little punches still create a very tiny scar in the back of the scalp. However, if the extractions are done not in a specific pattern, then it may not be that obvious. A lot of my patients actually cut their hair extremely short, right? And I ask them, has anybody ever noticed that there are any patterns in the back of the scalp? And they say no. Wound healing is very important. In fact, this back of the scalp is one wound. So I use a special product called ACell. ACell are growth factors that accelerate wound healing. So in this case, this is a patient who had FUE procedure done, and this is the back of the scalp. And he used ACell on the top region in the red rectangle, and he didn't use ACell on the bottom region. And you could see by day 7 the significant healing potential of ACell. A cell are growth factors that are derived from the extracellular matrix of a pig bladder. It just promotes faster and better wound healing. It is FDA approved for wound healing. Its use in hair restoration is off-label use. However, we do use it and patients do pretty well. There are also other things that I do to ensure very minimal scarring and very good and natural pattern in the back of the scalp. One of the most important is that I'm very much involved in the design of the tools I use. So some of the punches that I use, I do design them myself, and they allow me to extract grafts with 2s and 3 and even 4 hairs very well. I also design silver metal cups that the technicians place on their fingers, and the grafts are placed inside, and the grafts are removed from the cup and are placed onto the little slits. The reason why these little things make a big difference is because we do not want the grafts to dry out. We want the grafts to be embedded inside solution, kept moist at 4 degrees Celsius at all times. So this cup is made out of pure silver because it retains the temperature. And a lot of technicians in a lot of places put the grafts on their fingers for a very prolonged amount of time, which can dry up, and the temperature can drop, which damage the grafts. In our practice, these silver cups enable the grafts to be moist and kept at a low temperature. The technicians remove the grafts from inside the cups onto the edge of their finger, and then they're placed inside the slits very efficiently, smoothly, without damaging the grafts, without allowing the grafts to dry, and without allowing the temperature to increase. Important factors that keep and increase graft survivability include keeping the grafts moist, keeping the grafts at 4 degrees Celsius, and also minimizing the amount of time that the grafts are out of the body. So in my practice, I only punch for about 2 hours. So this way, the grafts are placed back into the body as soon as possible, and you achieve and retain a very high graft survivability. Again, please note, this is not all a numbers game. That means not how many grafts you're going to get in one day. It's about the highest graft survivability with the highest quality of the grafts that you're going to get in one day, because you have a very limited amount of donor grafts, and you want to make sure whatever you're transferring, you're achieving very high graft survivability. Thus, according to research and our research, 2 hours of extraction time achieves a very high graft survivability. The grafts that come out of the body first are placed back into the body first. We take very good care of the grafts while they're out of body. They are sitting on ice at 4 degrees Celsius. Now let's talk about hairline design, which is one of the most important part of entire hair restoration and hair transplantation. So the distance between the level of the eyebrow and where the hairline begins, so your forehead height and forehead length, is very important. Now I could tell you that at any age, being conservative, age appropriate, and natural is very important. I see a lot of patients who want a very low hairline, rounded, like when they had it in their teens. Unfortunately, it may not be age appropriate as you get older, natural, and most importantly, it's very difficult and challenging to dense pack the hairline when you go below the curvature, because the skin thins out significantly and the length of the hair follicle is longer than the thickness of the skin when you get around the curvature. So once the hair grows in, there will be a lot of see-through, because the hair is more going to be pointing in the forward direction and it's hard to dense it up. Also, it's very hard to get the angulation correct when the curvature, right, when the hairline goes below the curvature. Age appropriate and natural hairlines are based on your facial features. Hairline height that looks natural and age appropriate is set around 8 to 8.5 centimeters from the level of your eyebrows. The corners is set by the lateral part of the eye. This is what people see as natural and age appropriate. And I see a tremendous amount of patients who go and have hair transplant done and the hairline height is very low, is rounded, and they spend thousands of grafts doing it. The problem, you could run out of grafts. You only have a finite number of grafts. So important things about hairline design: number one, right, there's a supply and demand. That means you have finite number of hairs in the back of the scalp. If you use it all at the hairline, and as you get older and you lose more, you may not have enough to finish the whole project, right, and give yourself a nice finished look. Second, it may not look age appropriate. Third, you may not be able to get the exact good density, and the angulation may not be right. So when you come into the office, I'm going to design a hairline that is based on your natural features, looks right. And the goal is to take an area and dense pack it as much as you can. So when somebody looks at you, right, it just looks natural and thick. Sometimes I feel when people overdo it and come too low, it may not look as dense and the angulations are off, and it may actually give the illusion that you are thinning. So keep that in mind for the hairline design. For the crown area, I set the angles really flat to the skin so the hair grows along the calic and it looks natural and dense, and that is very important. The hair transplant day goes as follows. We start very early in the morning and we basically go through all the information that is necessary to create a very nice hair restoration that is natural, age appropriate, and long lasting. So we go through the entire consent together. I draw the hairline, you approve it. Then I basically shave the back of the scalp, which I'm doing that myself as I explained the importance of it. I leave a small amount of hair that protrudes outside the skin so I could know the exact angulations and directions and the groupings. And I color it if I need to. I give you some Valium and Xanax, which are optional, as well as laughing gas. And I numb it. I extract it myself. And then we have lunch. And then I numb the area that the grafts are going to go into. I make the sites myself. As I mentioned before, I spend as much as time necessary to create the right density and angulations, and then we place it. And then I love to see you the following day if that's possible. For all my out-of-town patients, FaceTime, everyone has my personal cell phone number. And all the transplant grafts fall out within the first 1 month. Within the first 2 weeks, you're going to have scabbing. I'm going to show you how to get rid of the scabs. I have a nice 25-minute post-op video that talks about all the post-op instructions in detail. Just to let you know, every one of my patients have my personal cell phone number. Every one of you can contact me or Steven at any time, and we'll get back to you. And this is very important. So the important things about how I approach my hair restoration are, I do it myself. Everyone has my personal cell phone number. I've been following patients for the past many years, right, very carefully, and I have a lot of techniques and methods to minimize the downtime after procedure, as well as maximize the density, the look, the naturalness, both short-term and long-term. Thank you so much for watching this video. If you would like to have an in-house consultation or virtual consultation, please contact my office. And if you want some more urgent appointments, you contact Steven and he can squeeze you in and we can see you sooner. Thank you and hope to see you soon.